We're taking a closer look at President Trump's vision for our country. On his first day, he signed executive orders to pull the U.S. out of the World Health Organization. This is the second time he's done that. He also rescinded former President Biden's executive orders that had been designed, Biden said, to strengthen Medicaid and Medicare. In his inaugural speech, Trump also vowed to end the chronic disease epidemic in the U.S. and, quote, keep our children healthy and disease-free. So far, we don't have specifics on the plan there. Here to break it all down is our chief medical correspondent, Dr. Jon LaPook. Dr. LaPook, thank you for being here. The World Health Organization is one where I'm just trying to wrap my head around it. What does it mean to be pulled out of it?
Well, first of all, think of the World Health Organization as sort of the United Nations for health. And in fact, it's part of the United Nations. And so he can pull the United States out of it. It's going to take a year for that to actually stick because that's what the rules say. So we still have to finance it for a year. The reason why he's doing this, he's saying, is because he feels we're being ripped off, that we're paying far more in proportion to, say, our GDP than a country like China is. And he's also not happy with the WHO for how it handled the pandemic.
So what are the implications of it?
Well, public health experts who I've spoken to are concerned that, we have a world leadership position with this. And if there is, for example, the next pandemic, it would help in terms of communication to be able to sort of be in communication with everybody around the world. I mean, you can rely on other things like individual societies and individual people, but it's nice to have a coordinated effort.
Yeah, especially during COVID, we remember how important the WHO was. But moving on, one of the things that he did yesterday was undo executive orders that President Biden put in place, including to strengthen Medicare and Medicaid. What are the implications of that, you think?
Bob Costa, I heard earlier, said it's basically an unraveling of what President Biden did. And I think that's sort of where we are right now. If you look at polls, the American public cares most about Medicare and Medicaid and the Affordable Care Act. And we're seeing dialing back on that, but we're not hearing what's going to happen. The Affordable Care Act, there are these subsidies that are going to expire at the end of 2025. And it's been estimated if those are not renewed, 2.2 million people will lose their insurance. So, the stakes are high, but we don't know what's coming. That's the thing.
I mean, so much happened yesterday that people are still digesting it. This is one of the ones that I'm still trying to catch up on. I mean, it's not like Donald Trump ran on a campaign to weaken Medicaid and Medicare. So if Joe Biden claimed that these executive orders were strengthening it, and then Donald Trump has rescinded them, there's got to be an explanation other than weakening Medicaid.
Well, yeah, I think the president probably would not say that the idea is to weaken Medicaid.
There's got to be an argument here.
But the idea is, how much money are we going to spend? There are still 10 states that have not accepted the Medicaid expansion. We have the drug price for Medicare people, the reduction of that, and that's under the Inflation Reduction Act, which is a Biden initiative. So it may be a matter of just dialing back that, and then here's what I'm going to do. And I think right now, I think you take a deep breath, you exhale and say, okay, what do you have instead?
So RFK Jr., of course, is Trump's pick to lead the Health and Human Services Department. He has to be confirmed. But what influence could he have on vaccines? That's something that he's been famously skeptical about.
Yeah, I actually did a deep dive on how this all actually happens. So there's an advisory committee to the CDC. And the voting members are appointed by the Secretary of HHS. That could potentially be RFK Jr. In addition, he gets to, or they get to, appoint the head of the CDC. Now, they have input from other societies. They come up with the guidelines. We think this should be here, and this should be there, and this should be this time. The people who actually decide the mandates are the states. But he could have influence, sort of, if the person on top of the political people are saying, we're not so sure, that could trickle down. And we're seeing already these pockets of places where people they're dipping down underneath herd immunity, and we're seeing the outbreaks of measles and things like that. People forget what it used to be, right? I actually looked at this just recently. Compared to pre-vaccine, if you look at the 10 of the top childhood illnesses, every year vaccines prevent more than 1 million cases and more than 10,000 deaths. That's in kids. Wow. And if you look at like the measles, for example, there's a very dramatic graph. I think it's the most dramatic one I've seen, where in 1963, the vaccine, came along, and wow, you just see this cliff of cases. Used to be about 500,000 a year with 500 deaths in kids.
Well, we'll see what changes come to vaccines. And if we pull out of the WHO in a year, how those two things may converge.
Wait and see.
All right. Thanks, Dr. LaPook. Always love having you here.